Hello, and welcome to the Multiple Sclerosis Association of America's educational web video series, A Closer Look. The following program is presented by the Multiple Sclerosis Association of America and is made possible through the generous support of EMD Serono and Pfizer. Hello, and welcome to the Multiple Sclerosis Association of America's educational web video series, A Closer Look. In this program, we'll be taking a closer look at the value of MRIs, including the important role they play in the diagnosis of MS, in the tracking of disease progression, and in the evaluation of the effectiveness of prescribed therapies. We'll also be learning about MSAA's assistance programs designed to help make MRIs affordable and easier for you to obtain. This three-part program will feature an MS patient who will provide a first-hand account of her MRI experiences, a noted neurologist who will explain the test and how it helps physicians to better manage MS, and a representative of MSAA who will discuss the MRI Diagnostic Fund and the MRI Institute program. To begin, we traveled to northeastern Pennsylvania and the home of Antoinette for her perspective on MRIs. Here she spoke with us about her own personal experience with MS and the role that MRIs have played in her diagnosis and treatment. Antoinette, thank you for inviting us into your home. To begin, when did you first start having problems that you later discovered were related to MS, and what did you do about it?
I first noticed symptoms of my MS in January 2006. I was having trouble holding a pen. In June, I couldn't hold the pen and write, and by the end of December, I couldn't write at all. I went to my chiropractor first, and I told him some of my symptoms I was having, and he suggested I went for medical help. I made an appointment, and that was June of 2007.
How was your diagnosis confirmed?
I had a MRI, I had a spinal tap, and they both confirmed that I had MS.
Where did you go for your initial MRI, and can you describe what it was like?
I went to Geisinger in Danville, Pennsylvania for my first MRI, and I didn't have any problems with the MRI. I was scared at first because it was a very small tunnel, but and there was a long thumping noise, but I really didn't have any problems with the MRI, and it was an easy effort going through it all.
I'm wondering, when your doctor first confirmed that you had MS, what was your reaction?
When I first learned that I had MS, my doctor came and told me that the prognosis of all my tests, pretty straightforward. He just told me, you have MS. And I went home and I was literally in shock. And I had all these appointments to see a neurotherapist, and I wasn't sure really why I was there. I was in shock, and it took me like 6 months to figure out that I really had to become honest with myself and with the disease, and that I was a disabled person. I had a problem with that word, was coming to terms that I did have a disability.
Once you came to terms with the fact that you have MS, what did you decide to do about it?
I decided to use an FDA therapy right away as soon as I learned the diagnosis of my condition, that I didn't want anything further to happen to my MS or to myself.
What, if any, have been some of your more recent symptoms, and what adjustments have you made in your lifestyle to manage these?
The biggest change to my lifestyle has been my right arm. I call it the dead fish. It's there, but primarily it doesn't do anything. It works without any accuracy. So I had to learn to use everything I used to do with my right hand. I had to learn to do everything left-handed. Because I don't have handwriting, I learned to use the tools that I have, and I now depend on my computer for my grocery list, for journaling, for wish lists, for letters, all that type of information.
I understand that you got a follow-up MRI. What was the reason for that?
My follow-up MRI took place because I was having more symptoms than usual, and I thought I was having exacerbation. My doctor suggested this MRI, and to make sure that I didn't have any new lesions. And I wanted to know if my medication was working for me, and it was. From a new MRI, you would find out if you have active lesions, if you would have new lesions, or if you actually have positive and shrunk the lesions, or you can have less lesions. You just don't know without an accurate MRI. My follow-up MRI showed no new lesions at that time, which was good news for me because it was telling me that I was doing the right thing with my therapy at that time.
Earlier you mentioned your experience of getting an MRI. Can you give us some more details?
When I went for my first MRI, I had no experience. I was treated with a lot of respect. I was asked if I had any medals on. I said yes, and they gave me a locker, and I put my personal goods, my purse included, into this locker. I was given a gown, I put a gown on, and then I was laid on the MRI table. I was put in position by a technician very easily. I was helped on the board, and they had given me a step to step on, and they put me in. They asked me several times if I was claustrophobic. I said that I wasn't, and a few times he went through on the microphone to make sure that I was doing okay in the tube, and I said I was. Then we stopped. I got an injection for the IV to do the scan with contrast, and I didn't have any reactions to the intravenous unit, and we continued to go from there. And when the procedure was all done, I went back to my car, and it was life as usual. There was no problems.
What was it like being in the MRI machine?
The technician gave me a pair of earplugs, which he put in for me because I was having difficulty. And then he put a set of earphones over them. And when I was in the tube, I heard just a thumping noise. And it was tolerable at that point. He asked me several times if it was okay, and I said I didn't have any issues, and we continued the testing.
Having had a number of MRIs, what are your thoughts about the experience?
There's nothing scary about having an MRI. It's just an inconvenience if you think about it. It's one of the easiest tests in the world. The reason why I did the interview today is because I want to let my fellow MSers know that there is hope out there, and there is the opportunity to take a look at doing the MRI sessions. And if I can pass off my feelings towards the MRIs, I just don't want them to be scared of it for the wrong reasons, and I want to give you the information to understand that it will make it easier.
I understand that you contacted MSAA for assistance with your follow-up MRI. Can you tell me about that?
I found the program that MSAA offered for the MRI Institute. I filled out the proper paperwork and informed my physician that I needed her signature at that time for the MRI. The MSA staff was very friendly to me, and it took a matter of days in order to approve my application for the MRI. And I had a very positive feedback from them.
What are your plans for future MRIs?
For my own disease, I want to follow up and have more MRIs done every year, including my C-spine, to make sure that those lesions aren't any larger than they are on my spinal cord, and also my brain activity.
Given that you live in a very rural area, do you find it difficult to stay connected to the MS community?
90% of my day actively has been on the internet talking about the success and failures with people that understand my condition. I live in a very rural area that doesn't have a lot of support, and I get the support from my family on the internet. The MSAA website is very informative. It has helped me through a lot of the events that I had, and I didn't know that there were so many opportunities out there for me that I can ask the MSA for, including the equipment and also for the MRI Institute. I'm excited that MSAA is getting into the videos online. I do a lot of research on the internet, and video capturing is much different than the research that I've been reading every day. It's very helpful to have video for a lot of MS patients. A lot of MS patients have visual problems with text, so the video will help them immensely.
And I'm sure our viewers will very much appreciate your participation in this video. Finally, what advice would you give others to live successfully with MS?
To live successfully with MS, I think you first have to understand what MS is and do the research to understand the disease. Once you have a clear indication what the disease is, never give up the fight. It's always worth fighting for. Your life. It's only another hurdle in your life. And I think you need to understand that.
In our next segment, we explore the science behind MRIs and learn how physicians use this technology to better manage and treat MS. For this, we traveled to the University of Medicine and Dentistry of New Jersey to speak with neurologist Dr. Diego Cadavid. Dr. Cadavid is an assistant professor of neurology and a leading expert in the field of MRIs. Dr. Cadavid, thank you for speaking with us.
Sure.
To begin, can you briefly explain what MRI means, how it works, and what the MRI images can reveal?
MRI means magnetic resonance imaging, and it is a powerful technique that has been developed for medical uses. But through all the developments in physics and computer technology, it was possible to actually take sophisticated images of the human brain and spinal cord, and actually anywhere in the body, using a property of the living human tissues. It gives the name to the technique, magnetic resonance imaging. So in simple terms, a big portion of the human body is made out of water, and when the body is placed into a magnet, the magnet can actually elicit certain properties into the water that will be different between different tissues and also between the same portions within one tissue based on whether they're healthy or sick. And the beauty is it is very safe, and it can be done many times over time. So it has really changed the way we practice medicine, not only in MS, but in general.
What do you do when you're preparing a patient for an MRI?
When a patient is going to have an MRI, the first thing that we do as physicians is to make sure it is actually safe, because the MRI will actually use a powerful magnetic field. If the patient has any piece of metal in its body, especially if it has any iron and certain metals, there is the risk of causing some damage to the body. So in general, we always make sure the patient doesn't have any pacemaker, any nerve stimulator, any shrapnel, or any pieces of metal that if the patient comes into the magnet can actually cause some damage. The second thing that we make sure is that the patients have normal renal function, because sometimes we use a dye and we always want to make sure that the body will be able to handle the dye. The third thing we make sure is that the actual, if the patient has an insurance, that the insurance will authorize it and agree to pay for it. And it is very important because MRIs are wonderful exams, incredibly useful, but they are also expensive. And we always make sure that things are done properly so patients don't get hit with a bill that should otherwise be paid by the insurance. Once the patient is ready for an MRI from the point of view of who will pay for that, the next is to actually set up an appointment.
Can you take us through the process of an MRI exam?
There are different kinds of MRIs, and we will talk about that later. But in general, the patient will actually go on the table and it will be entered so that the head will be surrounded by the machine, which has different components, most importantly the magnet and the coils. It's very important the patient needs to know that he or she should not move. Unfortunately, MRI is very susceptible to motion, and it is a common problem. If the patient moves, we are not going to get good images. So they have to hang in there, hold still, and work with the technician. But after the time that all the tests are completed, the patient will be removed from the machine. Sometimes we inject an intravenous contrast agent, referred to as a gadolinium, so that the patients, if they hear the word, they will know what it means. And that will require that an intravenous line is placed and that the actual injection is given.
Specifically in regards to multiple sclerosis, how is an MRI useful?
MRI has changed the way we approach multiple sclerosis, and there are three main impacts. One has been at the time of diagnosis. The second is how we follow the course of the disease, the response to therapy, and the third one in research. So I'm going to go over those three. The first one is when a patient is suspected of having multiple sclerosis because of certain characteristical symptoms. It is uniform this day that the doctor, before giving the actual diagnosis, will order an MRI most of the times of the brain, and in many occasions of the spinal cord. The reason is because MS, that's how we refer to multiple sclerosis, MS leaves a characteristic signal changes on these images created by the computer when the patient goes into the machine. And we expect that a patient who will be diagnosed with MS should have those lesions. The lesions are also very characteristic, and I'm going to expand on that. They are located in certain areas of the brain. They have certain characteristic shapes. They're also behave in a special way when we give this intravenous contrast agent or magnetic agent that we describe. In fact, the signal changes of the MS lesions is so relatively characteristic that formal diagnostic criteria has been created that makes a patient much more likely of having MS or less likely of having it. So when your doctor orders the MRI and gets the results back, the doctor will carefully look at the number of lesions, where those lesions are located, their morphology, and whether they took or did not take the contrast agent. And based on those characteristics, the patient will be much more likely or less likely of having multiple sclerosis. It is important to say that no patient can be diagnosed with MS only on the basis of an MRI. That is something that's clear. The MRI is one of the tools that we use to help establish the diagnosis, but it is by no means the only tool. One of the main aspects of the MRI in diagnosis of MS is that over the last few years, it was accepted that if a patient who may have MS develops MRI changes over the next few months without any symptoms, only MRI changes, now we can use those MRI changes to make a definite diagnosis of multiple sclerosis, while in the past we had to wait for another bout of symptoms to become apparent. So those are the aspects on diagnosis. The second aspect, very important, is the MRI is a very powerful tool to actually look at the brain and the spinal cord as to what lesions are occurring, what are the characteristics of those lesions, when and how often they're taking place. Because when we put a patient with multiple sclerosis on a therapy, we are expecting that the therapy will help, but we don't know that for sure. So monitoring the response to the therapy becomes very important for both the patient and the physician. So by using MRI, we can actually see whether the patient is responding to the therapy, even those who are not having new symptoms. The value of that is because we have now newer and better drugs to treat MS, but also with more serious side effects, and we have to become better at targeting these newer drugs and use them earlier on those patients who truly need them. And MRI gives us the opportunity of detecting who needs them before they actually go and develop attacks that may result in permanent damage. There is, however, some controversy as to the extent that these MRI lesions will impact on disability. But overall, that takes me to the third question, which is that of research. We are learning an incredible amount of information about MS from MRI. We are learning that, for example, the majority of new lesions in the brain do not actually have symptoms. And that's very important because symptoms in MS are the result of the location of the lesion. We say that it's like real estate, location, location, location. So if you get a small lesion in the optic nerve, you will notice your vision changes very rapidly. You will call the doctor right away, and we will say you're having an attack of MS. But you may have a much larger lesion in the frontal part of your brain that will also be of consequences, but later on, and you may not know you have it. MRI will tell us that it is there, that it is new, how big it is, and how is it healing or actually resulting in permanent damage.
Earlier you mentioned giving the patient an injection for the MRI exam. Can you tell us what that is and why it's important?
Very often when we order an MRI in an MS patient, we request the radiologist to obtain images of the brain or the spinal cord before and after giving an injection of an agent. We call it a paramagnetic agent. What it means is that when this agent is circulating in the blood and the magnetic field is activated, the computer will be able to detect the presence of this agent. That's why we call it paramagnetic. The name of the agent is gadolinium. And it is very important because when MS lesions are active, in the sense that they're inflamed, they will damage the so-called blood-brain barrier. The blood-brain barrier means that the brain is actually protected from a lot of what's present in the blood, and only what really needs to get through is allowed to get through. But in MS, at the onset of nearly every new MS lesion, or probably all of them, the blood-brain barrier is compromised. And this injection, which is circulating in the patient's blood, will be able to leak through the blood-brain barrier and enter the brain or the spinal cord, and it will show up as a bright signal on the image. And it is very informative because it will tell us, the physicians, that at the time that the MRI was done, the disease was active, the blood-brain barrier was disrupted, and has the potential to cause a lesion that may not be reversible. Therefore, it requires from us physicians to try to help the patient, and there are different therapies that we have at our disposal. So if we do not use this injection and we see a lesion, we have no way to tell whether it is new or old, and it could have been there for 20 years, in which case we wouldn't do anything about it because it's old, it already healed or caused damage. But those lesions that are very new, we can do a lot about them, and we need to know.
Can you talk to us about advances in MRI technology?
The technology continues to improve. One of the aspects that is very important to patients is that the strength of the magnet has been going up. And I give the analogy to a digital picture. You know, the more pixels you get, the better quality your image will be.
Some patients may be apprehensive about having an MRI due to claustrophobia, for instance. What are some of the steps that can be taken to put them more at ease?
The technique has evolved trying to accommodate those patients. So you may find that some places will advertise open MRIs. These open MRIs tend to be, the closed space tend to be shorter and wider. So you might get a little bit more room. Some of these machines allow patients to have the head out, but that doesn't apply to MS because in MS we want the head being scanned. But you may find that an open MRI gives you a little bit more room. The other new technique that's coming is a stand-up MRI. I do have patients who cannot tolerate even an open MRI, but they will go and have a standing up MRI. Those don't have very powerful magnets, but we still get an image. It's not the same resolution as a 3 Tesla like the one we have here, but we still get information. So patients need to know that if they do have claustrophobia, there are different things we could do. We can try to give them a medication to let them relax. It won't be anesthesia, but they will be calm and they may be able to hold still. Or alternatively, they can go around and find a place that offers either an open MRI or a stand-up MRI.
With research indicating the tremendous value of MRI information, is it now easier for MS patients to get access to follow-up MRIs?
Things are much easier now for patients when we order an MRI compared with the 1980s when the first machines were available. Not only the machines are better, as we discussed earlier, but the number of centers that have MRI capability has grown immensely. Even in our own medical center, we have 3 or 4 MRI machines. Insurance companies are not really giving us a hard time as long as we don't abuse the number of MRIs, which is not really necessary. If we order an MRI every 6 to 12 months in general, we don't have problems. Insurance companies will pay for that. And for those patients who may need additional help, either because of lack of insurance or high co-payments, there are other funds available that they can look, like the Multiple Sclerosis Association of America.
And finally, Dr. Cadavid, what advice do you want to give patients who are unsure about getting a follow-up MRI?
The management of multiple sclerosis these days requires that the doctor gets the best possible information as to what the disease is actually doing once a patient has been placed on a specific therapy. We don't have a cure for MS. We are not very good at repairing damage. Hopefully in the future we will be, but right now we are very good at intervening early. We have better drugs, some already approved, some are being tested. So the earlier we find out that your disease is active or not controlled, the sooner we can start the best available therapies. Studies actually have been done that show that if you show your disease is active by MRI within 6 months of starting your therapy, chances are that that drug is not sufficient to control your disease and you may be better off trying something else. So overall, work with your doctor, go to your visits, but also if your doctor recommends an MRI, my advice is go and do it. A doctor who knows the information from the MRI, in my opinion, will be in a better position to give you the best possible advice about how to treat your MS.
As you can see, from both the MS patient's perspective and the physician's perspective, MRIs are vital in order to accurately diagnose the disease, to effectively track disease progression, and to best evaluate the effectiveness of prescribed therapies. But what about the cost? And even for those who are fortunate enough to have health insurance, what about the co-pays and sometimes difficult process of dealing with health insurance providers? For some good news on that front, we spoke with MSAA's Vice President of Programs and Evaluation, Bob Rapp. Mr. Rapp, for the benefit of our viewers, can you describe the assistance programs that MSAA offers to patients in need of MRIs?
MSAA offers two MRI programs. The first is a diagnostic MRI program, and that is for individuals who do not have the appropriate insurance coverage or the financial means to get an MRI to determine whether they have MS. Now, this is of critical importance because one could imagine that if you have certain symptoms that may suggest MS or maybe possibly some other disease, that it is very important that you find out what's going on so you can get the appropriate treatment. The diagnostic program will assist individuals in paying for an MRI if they cannot afford that. The second program that we have is the MRI Institute. And it differs from the diagnostic program in that you do need to have a clinical diagnosis of MS. This particular program assists the individual and the neurologist in following their disease progression. It is very important, especially in MS, because sometimes there's activity going on in the brain that does not manifest itself in terms of symptoms. So to get a full and complete picture of the activity of MS, one needs to have both pieces, an MRI and a clinical evaluation.
Can you give us more details about the MRI Institute?
There are three ways that the MRI Institute can assist an individual with MS. The first is through advocacy. For individuals who have insurance policies, but their insurance companies are reluctant to pay, our staff has the ability to work with the insurance company and neurologist to secure coverage. The second way is to assist individuals with their co-pays and deductibles. Many policies now carry very, very high co-pays and deductibles, and if people qualify for the program, we can assist in terms of assisting people in meeting those. The third way is to actually pay for the cost of the full MRI.
How easy is it to apply for assistance through this program?
To apply for the MRI Institute is a very, very simple process. You could get an application by calling MSAA directly or by downloading it from our website. There are two parts to the application. One needs to be completed by your physician, the other by yourself. Once that application is completed, it is then sent to the MSAA MRI Institute staff, who will begin to contact your insurance company or begin to schedule a MRI for you.
So applying for assistance is certainly easy enough. Are there any final thoughts you'd like to share with us regarding the value of follow-up MRIs?
It's very important that an individual with MS get periodic MRIs. This is one significant way to track the course of the illness. And once we know the progression of the illness, and in fact, if there is progression, changes can be made in the medical treatment that person's receiving. But in addition to that, we survey our patients, our individuals who participate in the MRI Institute each year, and we find that many of them, upwards of 80%, will make a positive lifestyle change after they receive this MRI. Now, what do I mean by that? They may change their diet. They may start an exercise program. They may seek out more information about MS through an MS center or through a specialist in MS. So there are not only the medical benefits of receiving a periodic MRI, but there are also these additional benefits that allow a patient to get to take more control of their illness.
The value of MRIs. 3 perspectives, some good advice, and some good news. This concludes our program. For more information or assistance regarding MSAA's MRI Diagnostic Fund or the MRI Institute, locate these sections on the MSAA website or contact the MSAA staff at 800-532-7667 or at MSAA@msassociation.org.